Welcome to our next installment of Video Blog. Today we're going to be talking about arthritis and what it is, when people get it, who gets it, why, and how to take care of it. To begin with, arthritis is broken down into two groups. People who get it with age is considered osteoarthritis, and those who get it earlier on in life or for other reasons is typically called inflammatory arthritis. Within inflammatory arthritis, there are several types of inflammatory arthritis. A few include rheumatoid arthritis, which is where your body is basically, it's an autoimmune disease where your body is attacking its own joints. There's also AS, which is another type of arthritis where your body fuses the joints together, and these are things that are more genetically based or autoimmune based. But today we're going to be mainly talking about osteoarthritis, which is the age-related wear and tear of the joint that brings with it a bunch of symptoms that people don't like to hear about, but should understand them so that when it does occur, they know what to do. When do we get osteoarthritis? That can begin as early as our 30s, but often it's a little later than that, and it has to do with age or the wear and tear that occurs with our body. So when our joint is under stress, our body is meant to repair the damage that's done to the joint, but with age, just like the tires on a car, some of that wear and tear starts to show over time. Who gets it? Well, this can be a genetic relationship. Sometimes there's people whose families just develop arthritis earlier than others. Age does play a part in it, so at 70 years old, definitely people have osteoarthritis, and there's symptoms that connect with that. Lifestyle is also very important. So if you are someone who's working in construction or does a particular labor-intensive type of work, chances are that the joints that you're using most will have more wear and tear associated with them, which may give you pain or discomfort at some point. Diet is also important. You know, there's certain foods that rob our bodies of nutrients, such as processed foods, soda, smoking, alcohol. All these things affect the calcium makeup of our joints and our bones and can bring on arthritis at a faster rate. At the same time, eating a healthy diet can help to slow the pace of arthritis. Taking in omega-3s will help with inflammation that occurs with osteoarthritis. The location in our body where arthritis occurs will vary, but there are some common spots where osteoarthritis first shows. Typically, it will first show itself in the knee, the inside part of the knee. It'll also show itself in the thumb. It shows itself often in the feet and the neck. Low back depends on the structural support in the area, so if there's a lot of strength in the low back, it may not develop as quickly. But if there isn't support, then that wear and tear, just like the tires on the car, will start to show in the low back. How do we know if someone has arthritis? Well, some of the symptoms make it clear, such as waking up in the morning with stiffness. The joint is like a hinge on a door. If that lubrication isn't there to keep the joint moving properly, then when you first wake up in the morning, that joint will be dry and stiff. So getting movement in it will re-lubricate the joint, but once you go back to bed again, often that lubrication will start to disappear. That's a sign of arthritis. Weather. In some people with severe arthritis, there can be an ability to sense if it's going to rain, or if it's cold out, the arthritis might be worse. So the pressure in the air also affects the pressure in the joint, and if those bone surfaces are close together because there's a a diminished amount of cartilage in the joint, then you'll start to feel it in the joint as well. X-ray. Doing a simple X-ray can show what is going on with the joints. And oftentimes if care isn't helping, this will be one of the things that I would do, is to take an X-ray and see what's the status of the structure of the joint in question. How to treat arthritis. So this is the exciting part, because we can't unwind the effects of arthritis once they're there. So once arthritis has worn away some of the bone, we can't make that bone grow back, but we can do a lot to help manage the symptoms or prevent it from getting worse. Chiropractic is an amazing tool to help get the joint moving the way that it's supposed to. If the joint is moving the way that it's supposed to, the muscles around it will act the way that they're supposed to. Muscles often tighten in areas of arthritis because that joint isn't moving, and it's the muscle pain that people often present with. Pilates. Get strong. Do a low impact exercise routine that helps to strengthen and support the spine. If you think of the spine as like the house or the framework, it needs as much support as it can if there's problems with it to begin with. And low impact exercise, whether it's Pilates, swimming, even yoga, can be great ways to help strengthen a lot of muscles in a short period of time. Acupuncture can also be a good way to help manage some of the symptoms associated with arthritis. Massage is also beneficial and can give added range of motion, flexibility, and just relief to common areas. Medication is sometimes necessary when the arthritis is severe. Now, you'd have to speak to your family doctor about what types of medication may be recommended, but there are people who need more than exercise to manage their symptoms, and we'll work with the family doctor to find a medication that may help them as well. Heat can be really valuable in helping with pain. Heat relaxes and helps bring blood to the area, which can be soothing for someone who has arthritis. Either way, don't ignore your symptoms. Get it looked at right away to decide if that issue that you're having is arthritis related or something else. Getting treatment early is the best way to counteract the symptoms and make sure that that problem doesn't get worse. Hope you enjoyed this session, and we look forward to speaking again.